Hello and good evening, everybody. My name is Jennifer Gunning, and I have the pleasure of being the Senior Director for the Brain-Heart Interconnectome, or BHI, that's based at the University of Ottawa. The Brain-Heart Interconnectome, or BHI, is a very multidisciplinary or interdisciplinary research initiative. It's led by the University of Ottawa in collaboration with all of the University of Ottawa affiliated research institutes, as well as McGill University, the University of Saskatchewan, and most recently, the University of Waterloo. And the BHI is really intended to create new knowledge and to translate that new knowledge for the better prevention, treatment, and care of interconnected brain and heart conditions. And it is my absolute pleasure to welcome all of you here in the room with us this evening in Ottawa, as well as all of our participants online from right across the country, to this final event in the BHI State of the Science Summit. The State of the Science Summit is held every 2 years. It's our flagship knowledge translation event for the BHI, and we really like to take that opportunity to engage with our local community here in Ottawa and people right across the country in dialogue around the interconnections between the brain and the heart. Just before we get underway this evening, on behalf of the BHI and the University of Ottawa, we'd just like to pay respect to the Algonquin people, who are the traditional guardians of these lands that we're on here this evening. We'd like to acknowledge the longstanding relationship they have with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home, and to those that are visiting from other regions and nations. We acknowledge the traditional knowledge keepers, both young and old, and we honor the courageous leaders, both past, present, and future. This evening, we'd also like to take a moment to thank l'Académie de danse de l'Outaouais for the dance films and to our fabulous musicians who welcomed us all this evening. We really appreciate their very unique contribution to a scientific event. This connection of art and music really give expression to what research reveals about brain and heart health, that healing, wellness, and connection are fundamentally human experiences. So over the past 3 days, the BHI community of researchers, clinicians, trainees, and community leaders have gathered to explore what we feel is one of the most important insights emerging in health science today, that the brain and heart conditions are deeply interconnected and should no longer be treated in isolation or siloed. So this second State of the Science Summit, we close this summit with this public lecture, but because we recognize that this is not just of interest to scientists, but that this work really matters to patients, to caregivers, and to families who are navigating really complex health challenges. And we know, unfortunately, that although the brain and the heart are very much interconnected, that often this is not obvious, or it's not talked about enough, more broadly. And our healthcare system has really not caught up with this reality. We know that today, often patients still see one specialist for their heart and another one for their neurological or their mental health conditions. Treatment plans don't often talk to one another, and prevention strategies are often treated very separately. And so this siloed approach misses really important opportunities to prevent disease more effectively, to diagnose more accurately, and to heal more completely. And so the panel that you're going to hear from tonight, they're really leading the charge to change that. They're researchers, clinicians, and individuals with lived experience who understand that integrated whole person care is not just an ideal, it's absolutely essential. And so it's my pleasure to introduce you to our panelists this evening. We have Dr. Jess Federowicz, and Jess is the head and chief of medical health at the Ottawa Hospital. He holds a Tier 1 clinical research chair in bipolar disorders and metabolism at the University of Ottawa. In his research, Jess focuses on morbidity and mortality in bipolar disorders. In other words, on why people with mental illnesses experience higher rates of physical illness and what we can do about that. What sets him apart is truly his commitment to what he calls an integrative, interdisciplinary approach to care. He doesn't treat the mind and the body as separate domains. He treats them as they are, a connected whole. And that's a future of care that we're looking to build. Aman Mahmood, sorry. She brings something that no amount of research can replicate, a lived experience. Aman has navigated the brain-heart connection firsthand, living with both heart health challenges and mental health complexities. Through that journey, she has developed a deep understanding of what it means to access integrated care and what it means when care is fragmented. She is passionate about sharing this journey to support awareness, empathy, and patient advocacy. Tonight, Aman's voice will ground this conversation in reality of living with interconnected health challenges, which is exactly where transformation begins. We have with us Dr. Heather Folds. Heather is an associate professor who is joining us from the University of Saskatchewan. She has a Tier 2 Canada Research Chair in Holistic Health and Wellbeing in Physical Activity for Indigenous People. She also holds a Heart and Stroke and CIHR Chair focused on Indigenous early career women's heart and brain health. Heather's research is grounded in crucial recognition that health is not just about the absence of disease, but about holistic well-being, and that this understanding has always been central to Indigenous knowledge and practice. Her work focuses on healthy aging, chronic disease management, and human performance through an Indigenous lens. She brings this to the conversation, both rigorous science and wisdom about what it means to care for people in ways that honor their culture, their community, and their whole selves. We also welcome Vanessa Hall. Vanessa is a Métis mother and healthcare worker with over 20 years of experience in mental health and chronic illness care. She has also traveled from Saskatchewan to speak with us today. She has walked the path of supporting family members through chronic illness and mental health challenges. She has lived through those challenges herself, as have her sons. What Vanessa brings to this panel is the perspective of someone who understands deeply and personally what it means to navigate a health system that doesn't see the interconnection between the mind and the body. But she also brings something equally important, hope. She leads by example, that while this journey is very difficult, it is possible. And that's the kind of leadership we need to address these challenges. And we also have with us Dr. Maya Geddes. Maya is an associate professor at McGill University and a Killam Scholar, which is one of Canada's most prestigious research honors. She is a behavioral neurologist scientist whose work focuses on the brain mechanisms underlying resilience and vulnerability as we age. Her research program examines how the brain protects itself from decline and what happens when those protective mechanisms fail. More specifically, she investigates how motivation, physical activity, and healthy behaviors can prevent dementia and Alzheimer's disease. Her work answers a question many of us ask as we age: is it too late to change the trajectory? Her answer, grounded in neuroscience, is both rigorous and hopeful. So these 5 panelists bring together leading-edge research, clinical experience, Indigenous wisdom, and lived experience. And that's a really powerful combination. That's a combination that we need to transform how we understand and care for the interconnected brain and heart conditions that so many of our community members face. So over the next hour, the State of the Science Conference co-chairs, Dr. Baptiste Lacoste from the Ottawa Hospital Research Institute and Karen Bouchard from the University of Ottawa Heart Institute will be asking these wonderful panelists a series of questions about their work, their insights, and their vision for integrated brain and heart care. But more importantly, please know that we're also going to open the floor to all of you, both here in person and online. So your questions, your experiences, and your curiosity are really important to us, and we really encourage you to fully engage, and don't be shy. Don't hesitate to ask your questions or provide your comments throughout this evening. So I'm pleased to turn it over to Karen and Baptiste to get us going.
Does it work? Okay, thank you so much. Well, thank you for being here. It's wonderful to having such a diverse panel of different visions and expertise. So we'll start by asking a question on the integrated brain-heart care, and I'd like to start with Eman. So, if I may, I'd like to ask you a question on that siloed approach, having the heart and the brain, viewed and studied and cared for separately. And I'm wondering what you thought about if the brain and the heart were assessed together, what would it change for a patient walking into a clinic? From a patient perspective, what would be the benefit for integrated care through your vision of this question?
Hello, everyone. I went through both physical my journey was at the heart pain and the brain pain as well, and I dealt with both of them at the same time. I had some symptoms affected my entire life at that time. It was overwhelming. It was when I have some shortness of breath, I have difficulty concentration, I have a whole bunch of symptoms. When these symptoms get bad, I also feel, even the heart pain, it affected other side of me and too many parts of me. So this is, let me think that heart and the brain are really connected, and we can't treat any of them separate, because both of them, they are influence everything in the body. About if they combine them together and have integrated in care, it will be helpful for future patients who might have any situation like this, because brain affected heart and heart affected the brain as well. And patients sometimes left alone to connect between them, because you go for one specialist for the heart and you go for another specialist for the brain. So if there is integrated in the healthcare system, it will have like one clinic have both specialists or like communicate between each other. So this will help like the patient not have the responsibility to connect between them and tell his story over and over. And this can be exhausted for him because, as we said from the beginning, is heart and brain are deeply connected and we can't treat them separately because brain affected heart and heart affected brain.
Well, that's very well said. I think, Jennifer, we have a new director of the BHI here. Sorry, I mean, that is so well summarized. I mean, thank you so much. This is amazing remarks. And coming from a patient perspective, this is extremely important. So I want to ask and jump to Jess, because you have a connection to what she just said, and ask you about your research and how you bring the heart and the brain together and how this integration affects your approach to diagnosis and care.
Yeah, so I guess I can start with the research side. I've been very interested in the intersection between mental disorders, particularly mood and anxiety disorders, and heart disease, and how they may bidirectionally influence each other, which we know that they do. Clinically, I've always been interested in sort of whole health, and I see myself as a bit more of a generalist than a specialist, and wanting to sort of address the whole person, and it's sometimes frustrating working in a system where everything's siloed, where one thing's not being addressed in another section, and whether that's within psychiatry, not addressing the more general health needs of patients, or being in a specialty service and not recognizing the emotional distress or the other things that can go with the illness and health anxiety. What's nice about the clinic that we work in with the Brain-Heart Clinic is we're really trying to look at the whole picture, addressing the medical risk, communicating. We're embedded within the Heart Institute and trying to address sort of all those needs from mental health to health, and mental health is health. So.
Well, thank you. And before moving on to the next topic, I'd like to ask both of you kind of the same question, and you can answer in sequence, but what do you hope for that brain-heart interconnectome to be in the next 5 to 10 years? What do you hope from that initiative, or just the fact of taking those two in a non-siloed approach? What is your hope for the future? And you can start, Eman, if you want.
For like next 5 years, if they combine the heart health and the brain health, it will make the life easier for any future patient. Also, it will bring like more maybe experience or like live experience from people through the treatment. We can't see this usually in clinical data until they hear it from patient, because patient only who has the full story and full picture.
Jess, any comment?
I'm quite excited about the future, and I think the Brain-Heart Interconnectome is leading that in many ways. I mean, if we just look at this past week, right, this is day 3 of interdisciplinary people from all walks coming together to talk about this, and I think we're seeing more awareness within each silo, and more people that are looking to cross silos to sort of bring things together for patients to meet their needs in the clinic. So I'm pretty enthusiastic about the direction that I see things going, and I think BHI is a leader in that.
Wonderful, thank you. So give it over to Karen for the next topic.
Sure, thank you very much. So I have a question for Aman and Vanessa. I'm just wondering, if someone's watching tonight, and hopefully they are watching tonight, if someone's facing something similar to what you've gone through, what's the one thing that you would want them to know about your experience?
Okay. For everyone who watching today and who may be facing something similar in the future, I wanted to tell them that your symptoms and your experience are real. And your experience are real and your symptoms, so don't feel that you will be left alone. Even if the path to your answer is slow or complicated, you still can ask questions and seek for support. Also, advocate for yourself and advocate for yourself, and no one should feel that he will be alone facing the complex of the healthcare challenge.
Vanessa?
Hello. Thanks, Iman. I really have to agree with Iman on that you're not alone and that you have to advocate for yourself in our systems interprovincially, obviously. I'm from Saskatchewan, so this is a little different for me here, but that you are real, you matter, you are going through real things, hard things, and that without a doubt, the brain-heart is connected, and without healing one, you can't heal the other, and vice versa, right? If you don't heal your heart, your mind will not do well, and if you don't heal your mind, your heart will not do well. And not only just your heart, but your whole body. It doesn't just stop at your heart health and brain health, it's your whole being, right? And I think it's really important to remember that and advocate for yourself, and for us caregivers, to remember that they are a person, they're a real life person, and they're going through things, and it's really hard, and it's so easy to get lost. And as a civilian, we'll say, but like as a non-healthcare person or as a non-professional in this area or in any healthcare area, to get lost and be gone, right? And we're in this profession to help you heal the best that we can, in the best way that we can, and the best way for you. So if you acknowledge that there is a connection between the two, you can begin to heal the whole person, not just the one ailment.
That's great, thank you. I'm just gonna follow on that vein a little bit. So what you're doing right now is not easy. You know, you're on stage talking about your story, you interact with researchers who are not the most socially adept all the time. But I'm just wondering, what has your experience been being a patient partner, and maybe what has motivated you to become more involved in the research process?
What do you want? You go.
Okay. As a patient partner, what made me involved in this topic, because first, from my experience, I lived in that experience for the mental health and physical health, and for I'm sorry.
That's okay. Yeah. Vanessa, do you want to maybe comment? And then if you feel comfortable, you can comment after.
I can come back to you. Yeah, I think I'll share a little bit about my life in regards to that question. I, as a child, spent half my life at Sick Kids in Toronto, having surgeries, reconstructive surgeries, and coming back and forth between Saskatchewan and Ontario. And in that environment, I was exposed to the multidisciplinary team. We were a team there. That was what the goal was, right? You had your GP, you had your specialists, you had, orthodontics. All of that was in one building, or close to, if it wasn't. And everybody communicated and had a meeting as a team, and everybody was on the same page, and everybody had the same goal, and that was to heal me the best that they could in the best way that they could, right? and it was amazing. And then, no offense, home, but I go back to Saskatchewan and become an adult and choose to go into this career and healthcare career, and it's like completely different. It's very siloed. It's very, this is what you need to do, go see this person, and that's it. The communication isn't there, and it's so needed for the patients. As a patient, as a caregiver, as a mom with a son who has special needs, it is so important and so big of a role in the healing journey for the patients and for the caregivers that are looking after them. It's endless, the importance of it all, really. Do you want to add, Iman? You can, you don't have to. You don't have to.
Okay, sorry, excuse me, sometimes I just stuck with talking. For my experience at that journey was very long and was frustrated. It was affected me both ways, physical and mental. And in the beginning, I just lost the hope to find the treatment for what I feel and what I go through, even in the family or with friends or with any places, even socially, everything. I was just isolated after my heart issue. And when I start seeing Jess, he just helped me put all the dots together and connect them. And we were just work on the full picture together until everything get less stress or anxiety or even shortness of breath. And this is let me feel that if healthcare and brain brain health and heart health are connected, it will be easier for patient and for anyone, instead of seeing one specialist for symptoms, another specialist for another thing. And doctors usually focus on one organ, another focus on another thing, but only when they have the integrated in the care, even if that even if care system usually still treated heart separate than brain. Thank you.
Not yours? Okay. Thank you. Okay, Maya, I have a question for you, and then Heather, get ready because you're next. Okay, so concerning the prevention of brain-heart condition, I have questions for you, but the question that burns in everybody's mind now is, tell us a little bit about your research and how you integrate those two notions of brain and heart interactions.
Is this working?
Yes.
Yes, okay. Hi everyone, thanks for being here tonight. So I'm a cognitive neurologist, and I trained also in neuropsychiatry, so a combined fellowship. And my research really focuses on dementia prevention. And one of the things that's sort of critical in this is there's a lot of roots into dementia prevention. And we know that a lot of what we call modifiable risk factors, things that we can change, actually have benefit for mind, so preventing sort of neuropsychiatric symptoms, brain, so preventing dementia, stroke, and also for cardiovascular illness. So this is, you know, a wonderful opportunity in a way, because there's a lot of ways to build resilience across brain, heart, and also mind. And so my research focuses on some of the resilience pieces of that. And so we look at socio-emotional well-being, motivation. We try and understand the cognitive neuroscience of the processes behind adherence. Doctors tell patients to do a lot of things, you know, do more physical activity, eat differently, take medications. And what people choose to do is really sort of, we don't actually understand a lot about adherence. And so that's a really big focus of my research. And on the sort of risk side, we try and also understand how, for example, neuropsychiatric symptoms can herald or sort of happen early in a lot of these different conditions. So there's a lot of opportunities, and I think because there's so many intersections, that creates this space where we can kind of come at this problem from a lot of different angles.
Thank you. And I have a follow-up question. So there is evidence that a large proportion of dementia is or could be prevented or delayed through lifestyle changes. So what does science tell us nowadays about how much is within our control? What we can do about it?
Yes, so you know, I study motivation, so I'm interested in this question. So nice question, thank you very much. But when we think about what is in our control, I think one key part of that is we have to think about risk factors beyond the individual. So it's not just the individual, but it's an individual we talked about in, you know, a mind or a brain, in a body, in a society. And so when we think about control, there's only certain things we can control, and as physicians, we're often interacting with individuals, but there's a population level or contextual factors, or what we call social determinants of health, or social and structural determinants. So all these things around us in our environment that start, you know, in utero and take us all the way through childhood. So your education, all kinds of things that, you know, your immigration status, all kinds of things about your environment, things that can help support the individual. So when we think about in our control, as a society, we actually have a lot that we can do that's not at the level of the individual and that is absolutely critical to preventing brain, heart, and mind disorders. So I think that's important. In terms of what is modifiable, so from the dementia space, we know now that there's sort of 14 classic, but there's many risk factors that span, as I mentioned, in early life, but a lot of them are also cardiovascular. So things like smoking, your lipids, your blood pressure, these things have an impact both on neurodegenerative diseases, dementia, Alzheimer's, but also on stroke prevention and cardiovascular risk factors. And then there's a whole sort of suite of other things. So diet, social engagement is something that I'm really interested in, I study, as well as cognitive engagement. And so when you think about it, it's sort of this risk and resilience, and the opportunity here is that across your whole lifespan, you can build up brain capital, this idea of brain reserve. So there's lots of things you can do by being cognitively engaged, learning another language. There's all kinds of protective factors that actually account for something like 45%, and in some Canadian studies up to sort of 49, 50% of dementia cases can be modified through these different factors.
Thank you very much. So Heather, sorry, but I have the same exact question, not very original, but we want to know about what you're doing. And also a side question on beyond what is your research about and how do you integrate heart-brain access, how your community-based view has changed your approach of keeping people healthy.
So I'm Heather Foltz. I work with a lot of Indigenous communities, and so a lot of what Maya just said, I could say ditto, looking at all of those layers of physical health and physical activity and mental well-being, connecting with community. My focus and training has been in the cardiovascular side, so as you're saying that, affecting both, so coming from the two different organ focuses. A lot of my work right now is connecting how is identity and connection to community and connection to culture determinants of cardiovascular disease, mental well-being, a number of those kind of beyond the social determinants that Maya, kind of that next layer or the deeper roots of our experience as individuals and as members of our society. I know that we don't really think about culture if you're kind of mainstream within where we are, but for people who are from other cultures, they're experiencing something different, and that impacts our well-being and our sense of engagement, our sense of community, and how well we feel welcome or engaged. So, and I would say my perspective and worldview, and so I'm going to go back to Vanessa's comment that it's more than just the heart and brain, that it's all connected. I would say, you know, we are all related. We're all of those brain systems, but also our experiences and the society we're in and the culture that we're in. And I think Indigenous worldviews, Indigenous understandings have known this for thousands of years, and that you might have heard of the kind of medicine wheel approach, that our environment and our community and our physical self and our mental self, they're all connected and influence one another. So that I take that approach in my research, so I measure determinants, but determinants across all of those aspects of well-being and how we can improve heart disease.
Thank you very much. Your turn.
Okay, so now I'm going to ask the researchers in the room. I'm wondering if you could tell us about one maybe common myth or misconception about brain-heart health that maybe you would like to, you know, set the record straight tonight.
Sure. I think, you know, one of the things that I'd love everyone to take home tonight and maybe address, you know, sort of as a myth, is that sort of research happens somewhere else. It's happening in the university. It's happening outside of our communities. One of the things that I would love is to invite you to join us, because we really, I think all of us, and certainly BHI as a community, believe strongly in this idea of co-design, participatory research, co-production. So it's not, you know, not without us, not about us without us. So we do actually need people with lived experience, people who are engaged, people who are interested in brain-heart health to join us, because we want to serve the community. And research is really going to benefit from your perspectives. So please get involved. So this idea that research is going to happen without involvement and engagement, or is going to be community oriented without your participation, is not the case. So that's, I think, an important myth that I want to debunk tonight.
Any thoughts, Heather?
Yeah, I mean, I think that's kind of the core of all of the work that I do. I'm not directing what my research is. It's what does the community tell me they need, and how can I then use research to support what the community needs. And I think that's where our innovation is happening, is that we're hearing lived experiences. You're telling us where we need to go and what we need to think about, and what are the experiences that are going to shape our understanding.
Jess, your turn.
Yeah, I have one. So I'm going to tell a little bit of a story with it, I think. So the myth that I'd like to sort of break is that the association between depression, anxiety, mental disorders, stress, and heart disease is causal. It is causal. The myth is that it's not. And so I'll tell a story. So we're fortunate, I think, to be in an ecosystem here where we have, you know, this Brain-Heart Interconnectome. We have CHR, which doesn't silo your grants as being a neurology grant or psychiatry grant. So, I mean, there's sections or what have you, but and where we have leaders from Brain Canada and Heart and Stroke that are, you know, pursuing integrative research that's not sort of siloing things. I had a conversation as a scientist with a program officer from the National Heart, Lung, and Blood Institute in the U.S. And I was talking about depression risk and risk with mood disorders and heart disease. And the program officer told me, I don't know anything about this literature, but I'll tell you that it's all confounding. And confounding means where one thing is, you know, is causing another thing. So it's like if it was raining today, right? If we're walking outside and everything's getting wet, and you see people wearing umbrellas, it's not people wearing umbrellas that's causing the rain. People are wearing the umbrellas because of the rain. And so there's this myth, I think, that it's all because of, you know, other behaviors or other factors that might be associated. So it's all because of smoking. I'm sorry, I'm getting some sort of signal that I don't know what it is. Oh. Oh, okay, thanks.
But you keep telling the story, Jess.
No, I was like, what is this?
That was not meant to.
Anyhow, yeah.
Thank you, Natasha.
Okay, and another thing people will say is, it's just if someone has depression, they're just not taking their medications or something like that. And that's why we see the association. It's not true. There's plenty of evidence that it's causal. And in fact, as I presented yesterday, the data suggests that actually, well, people with mental disorders are less likely to take, people in general are less likely to take psychiatric meds than other meds. People with mental disorders are actually, if anything, slightly more likely to take their medications for diabetes, for example, or other cardiovascular risk factors. There is a causal association. We know plenty about the biology and the neurobiology by which these stress circuits impact health, by which social determinants impact health, and it's not just soft science, that these are causal relationships. They're hard to study causal relationships, but that's the myth that I would like to break.
I'm sorry, Natasha, but I still have a question to ask to the panelist. No, I'm genuinely interested in knowing what you think about it. That's maybe for Heather and Vanessa. But from an indigenous perspective, what can Western medicine learn about brain-heart health and health in general? We are so ignorant about these facts, and I'd like to know your perspective.
I think kind of building on what I was saying before, that we know it's connected. We know it's more than just you. It's your community and your family and the people who support you, and the experiences you have when you go into medical centers that are completely foreign, and they may not speak your language, and they may not understand your culture or those connections. And so Western science, epigenetics, we've understood for four generations, I think. Western science has mapped indigenous communities 7 generations. So we know that seven generations, what I do is going to impact 7 generations down the line. So, and there's more Western research coming out now as well about the things that indigenous people have been through in the past, contributing to a lot of these experiences now. So I think if I'm going to pass something on to maybe clinicians or people in healthcare, that the person might be going through something challenging, but it's not all on them. There's a lot more that they're experiencing, that they've been through, their family's been through, that are they're struggling with all of these other challenges that are, maybe your other patients don't have those same challenges to face.
I think what I would like to pass on is that I agree with you on what you're saying. I think we're very much on the same page, that people need to acknowledge that it's not just your patient. It's, from an Indigenous point of view, it's the whole family. It's everyone. It's not just that one person. And to consider what that person and that family want included in their care plan or on their journey on getting well. And also what's contributing to them not getting well. Right? We want to know what will help you and what's not helping you, so that we can overall heal you, right? Back to the brain-heart connection, right? It's a whole thing. It's not just one thing.
Thank you very much. So now we can open the floor for questioning. So anybody has a question, don't hesitate. Yes, we have one on the back here.
Hi, thank you. I'm curious about your heart and your brain, but you left out the thing that feeds at your digestive system. Are you planning to connect the dots there? Because the reason I'm asking this question is I have a digestive issue, and when you go to normal Western medicine, they kind of look at you like irritable bowel syndrome, right? But I recently went back to traditional Chinese med and acupuncture. He goes, your stomach's not digesting well. I recommend you to cut out the sugar, the dairy, greasy food, cold temperature foods, raw foods, because your stomach needs some help. So any thoughts on how you're going to connect the whole system? Because this is just 2 organs.
Interestingly, the gut has a very large nervous system, the enteric nervous system, that is certainly intimately connected with all of these things. And there's been lots of research about how the gut and a leaky gut, or the microbiome, or the bacteria in the gut, can impact both heart and mental health as well. So that's an excellent point. Also speaks to what some of our other folks like Heather was talking about, the interconnectedness of everything, not just the brain and heart.
Yes, I'm interested to find out from you guys if what's the benefit of taking creatine monohydrate, the benefits to the brain, the heart, but mostly the muscles for somebody who's in normal good health. Creatine has been in the news lately, or has been in the news for a while. So what's your opinion on the benefits of taking a daily dose of 10 to 20 milligrams or grams of creatine? Do you know what I'm talking about?
I do know what you're talking about, and I wish one of my mentees, Nick Fabiano, I wish I could call him on, because I know he's been very interested in this topic. The doses that you mentioned, I think those are a little higher than recommended, aren't they? I think, isn't the 5 milligrams the typical? Yeah, I think 5 is the more typical dose. But I think this literature is still evolving. You know, there's been some suggestions of brain benefits. My mentee will talk about potential treatment for depression, but I don't think that this is not yet as evidence-based of a treatment for depression as many other options that we have right now.
Yes, I'd like to have your opinion that some people saying that they improve the brain if the dose is 20 milligrams a day. Is this possible, or?
Yeah, so I think Jess raised an important point about evidence-based. And so, you know, there's a number of therapies that are being tested, but until we have enough evidence, we usually don't recommend it on a population level. So you're raising an interesting question, and you know, the evidence hasn't really evolved to the point that we can sort of support it. And I think, you know, one thing just in terms of like general resources for brain health, you know, where can you go to get reliable information, you know, in terms of, you know, the public reaching out and having questions like this. So just in terms of some sources specifically for brain health that intersects with heart health, the Stroke and Heart Foundation, the Heart and Stroke Foundation have a lot of great resources. The Canadian Consortium for Neurodegeneration and Aging also have a lot of fantastic public-facing resources, and a number of the Alzheimer's Society, so Alzheimer's Societies and Alzheimer's Association also have a number of resources. So, you know, just in terms of like accessing brain heart guides, you know, there's the Brain-Heart Pro, but these are the kinds of resources I would recommend checking out. We're in a digital age where a lot of people are going to be asking these questions to ChatGPT, for example, or AI. So I just want to point people to, you know, where they can go to get reliable information, because you're going to be navigating a lot, and it's going to be a bit of the Wild West right now. So I would just point you to those things and say the evidence hasn't yet evolved to be recommending it on a population level.
I haven't looked recently on clinical trials, but I suspect it's coming, because I know there is a lot of interest in this area. I'm seeing a lot more of it in the media, so I suspect there'll be more studies coming.
Yeah, I'll take one from online, if that's okay?
Yeah.
So I don't have a mic, but I hope I'm speaking loud enough. So the question is, given that brain and cardiovascular conditions are still often treated in separate clinical silos, what are the most realistic first steps for translating brain-heart research into routine care pathways, especially for patients whose symptoms or risk factors cross both neurology and cardiology?
Yes, so currently these disorders, we had some themes talking about integrated care. So how can we bolster integrated care for heart and brain disorders, which are usually treated, you know, either in a cardiologist's office or in a neurologist's office or in a psychiatrist's office, but not necessarily crossing those different domains. So I think this is really bringing up the question of innovative models of care. So I think there's an appetite to experiment with, I think multidisciplinary clinics are really, your description as a child was like quite inspiring, and it's true. When you really have physicians working together, it's good for everybody. It has, economic benefit. Like we can, at every level, it's helpful for, the patient, for the clinicians, the communication amongst providers, and ultimately delivering better quality care. So I think there's really a desire for this kind of breaking down silos. And so that's describing sort of a multidisciplinary team, which I think you're doing a fantastic job. And at McGill, we're also breaking down barriers. So the Montreal Neurological Institute, where I work, is interested in partnering with a center of excellence in cardiology. So this is, exciting that people really want to go in this direction. But absolutely, integrated models of care is to the benefit of all.
I had a quick question about, earlier you talked about research and how you decide what you're going to research and how the community is involved in that. I'd love to hear more about kind of how you gather those questions. And, I've got opinions on what I would like to see researched, and I'm sure other people do too, but just if you could speak a little bit more about that.
Yeah, so Indigenous research is a bit more, takes it kind of to that next step. So I partner with communities, and in my experience, I build relationships with the community. So as a Métis person, I'm part of the communities that I'm working with, which gives me that extra level of responsibility to my community, more responsible to my community than my university, I would say. And so we have those conversations, and then some topics will come up, or ideas will come up, or when we start having conversations about research, and okay, well, this is where we need to go, this is what we need to be doing. And then we'll have conversations, okay, well, I can get grant funding this way, and this is the project, and usually there's community members who are the leaders, and they are part of the research team, and they're on the research grants, and we connect back with them. Okay, so here's the measurements I'm thinking about. I'm doing some Métis dancing, for example, so we're going to measure your health before and after you learn to dance. What measures should I include? And then, so I talked to several members, sent out a survey, got some feedback, and in that situation, they said, no, we don't need to measure cholesterol or blood sugar. We know that. We know what exercise does that. Look at our memory. So add measures for memory. And then I had meetings with community members, and they go through the questions, and they change the wording, and they change the order, and they're like, this doesn't fit well within our culture, let's change this. So kind of all those levels of how do we get involved. Working with Métis communities, then my responsibility for translating information we find. So I have kitchen dances at least once a year. We bring community members together and gather in our traditional ways, and I share information, and they give me feedback on where we're at, and then eventually we will publish things. But that's the community voice is more important. I think patient-oriented research is trying to use a similar model of that patient voice giving you that feedback, and different people and different researchers work in different ways, and all how involved people are. In my experience, in my situation, partnering with communities, I find it really keeps me accountable and holds me to that. One of the community partners that I work with talks about, well, you haven't been corrupted by the institution yet. You're still working on what we need, so we'll still keep working with you. So that kind of, in the back of my mind, that level of I need to do what the community needs, not necessarily what the academic stream would send me down.
And I just wanted to say it goes back to the patient-based centered care, right? What does that patient need? It's not about what we need, it's what they need, I think, and that's the goal.
So someone online is asking, this is very, very good, how do I get involved in research? You go to our website, Brain-Heart Interconnectome, just Google that, cross-code patient engagement, and there'll be some leads there that you can reach out to. And then one question here is, I agree with the question about gut health and connectivity, that was probably earlier on. So the question is, what is the state of research on the role of gut health and brain-heart connectivity?
So there's a lot of interesting microbiome research that's taking place, especially in sort of the dementia prevention area. Fascinating work where fecal transplants in mice actually cause the plaques that we see in Alzheimer's disease. Like there's, really fascinating work that's happening at this intersection. So there's, I think a lot of interesting, it's not the focus of my lab, but there's a lot of interesting work, and there's also a number of longitudinal cohorts that are actually gathering gut microbiome samples. So at McGill, we have the Courtois cardiovascular cohort of about 4,000 people with microbiome donation. So it's these kinds of open science initiatives that actually systematically gather information across, in this case, gut, brain, and hearts, and that will allow us to answer these questions, but also if it's openly accessible, it's available for any researcher to ask questions and sort of use. So yeah, it's definitely an area of very, very active research, I will say.
I'll just add, so the microbiome's massive, and profiling it can be quite complex, but there's many scientists, including some working with BHI, that are doing this. Sometimes individuals may have a microbiome profile that creates sort of a pro-inflammatory response in the body, and we know that that can have adverse effects both on cardiovascular and mental health.
So I'm thinking that next conference should be Brain-Heart Gut Interconnectome. Do we have another question?
Okay, so I'd like to ask, what are the best ways to reduce dementia risk, and is there a limit to how long the brain can stay healthy? Like as people, live longer and longer.
Can you repeat that question?
Dementia, like what's the best ways to reduce from the research the risk of having a dementia as we age, as people live longer, and is there a limit to avoid it?
There is a biological limit, although we're going to celebrate hopefully Brenda Milner, who's one of the founding neuroscientists at McGill at the institute where I work. She's turning 108 July 15th, so kind of pretty cool for a super ager. But actually, on a global level, education is the thing that will make the biggest difference. So if we're going to talk about population health globally, education is actually the most important. Things that we don't always think about, like hearing and sensory impairment, those come up pretty high in the list. So we actually know now that correcting hearing loss is not just about the hearing itself, but it's about the brain rewiring. All those things your mom told you to do are correct. So being physically active, eating well, being socially engaged, being cognitively engaged, and that can look very different for different cultures and different backgrounds. So it's not a one-size-fits-all. It might be kitchen dancing in terms of your physical activity. Your cognitive engagement might be learning the 3 languages that your family give you. That, all of these things, it's not sort of a recipe that's good for everyone. We know even that diet, depending on which community you're from, some of these recommendations will change, but these are the kinds of big ones. And then in terms of the heart-brain piece, the things that help prevent cardiovascular disease are going to help prevent dementia. So checking and intervening with your blood pressure is a really key one. Screening for diabetes and being aggressive in that. And one of the things that doesn't get a lot of press, I think, but that actually the BHI has just released clinical practice guidelines, is getting vaccinated. I know this is, can be contentious and, it's quite a political issue right now, but there is evidence for an interaction between vaccines and heart and brain, so stroke, MI, and dementia. So these are some of the things, but there's a number of other ones: sleep, traumatic brain injury, checking for sleep apnea, these kinds of things as well. So there's so many ways, and again, layers of population level versus what the individual does, and getting families to move together. That's one of the studies we just finished, is extremely beneficial. So the family-based, I love that idea of like the family focus when they come in, and when all of the patients that come into my clinic, there's always multiple generations. If I can treat the family as a unit, I know it's going to be much more successful. But those are some of the things to consider.
Yes, hi. First of all, thank you to all of you for the work that you're doing. I'm a family member of a stroke patient. The question I had was with regards to research. You had mentioned the importance of getting patients and community members involved in research. I think it was just mentioned a moment ago that we could go to the website if we're interested in signing up for studies. As someone who's been involved with my family member in the healthcare system for the past 13 months, I've seen posters in the hospital looking for research participants, but none of the specialists and family doctor or other healthcare professionals have ever asked about getting involved in research. So my question is, do the frontline clinicians recruit patients to be involved in research? Because from a patient perspective, we're very busy running from appointment to appointment, and unless you've got a family member who's looking for posters or looking for public events to go to, lectures on the website, the patients might not know about research. So are the clinicians encouraging them to participate?
Okay, yeah.
I have fairly strong opinions on this, but so in my lab, I always talk about how we have to go out and we have to meet the patients in the clinic, and we have to be in the community and meeting people, because we're not going to get referrals from clinical sources, even friendly clinical sources. And so I can give a couple examples. So when I first started my career, I cut my teeth on a clinical trial of omega-3 fatty acids for depression. And I went to several family practices, psychiatry clinics, and bought pizza and gave a talk on our study and met with everybody. I didn't get any referrals from those visits, and in our lab, it's all about finding people where they're at, and I think is the most important piece. And I have to also say, I've been, as a mentor, had mentees have studies, and I'm in clinic, and I'm with the patient, and I forget to mention the study because I'm so focused on them and their care. And then I get to the end of the day and I'm writing my note in Epic, and I'm like, oh my goodness, I forgot to mention, my mentee's study. And then I'll try to put reminders for that. So I just think we're so busy in practice and so focused, I think appropriately, on the person sitting across from us that sometimes we as clinicians forget. But I think it also just behooves us as researchers to get out to the community, to get out to the people directly and talk about it.
We d- We just finished a study actually where two of the students from my lab sat in a family practice waiting room and spoke to everybody in the waiting room and asked them about why or why not. So what are the facilitators and barriers to participating in research? And we had these students did what we call fuzzy cognitive mapping. So they made maps based on what the patients were telling them, and we connected the dots. There were arrows, and they made these, each person had a drawing. And we were trying to understand exactly your question, because actually one of the problems we have as researchers is not just the engaging patients, but also something that's called selection bias. So when we sample people from the population, we often get heterogeneous samples, and for the reasons you just said, I'm busy, how can I possibly do this on top of everything? How do I even know it's happening? And so it's actually something that, as researchers, that we have to work really hard to make sure that we're capturing a representative sample of the population. And what we learned in the study were that there were different factors for men and women as to why they would participate, or the barriers that they faced when they wanted to participate in research. So it's a really important question, and one I think that we don't, as a research community, carefully consider, because if we have biased samples, our conclusions are not for everybody.
Well, I guess I could follow up on that. The reason I was invited, and my wife today, is that we were early participants in a lot of these studies, and also we're quite educated. We keep up with all the latest developments, creatine, everything, gut health, spine. I got little of this problem, little of that problem. I do everything I can. Like I was 81 yesterday, so I do every one. I do everything I can to stay young, despite having had a sedentary kind of job ever since I was in my 20s, and I retired when I was 70. And I do the Brain HQ after the study. I do it a few times a week. And I managed to improve my score, to quite a good level for my age, and even for a 20-year-old. I don't know how credible it is, but the thing that limits me, I just want in the Brain HQ, for example, is I do have a hearing aid now because in the high pitches, and I have a little problem here for high female voices. Maybe I don't hear them as well, and the other ear I'm going to need one soon, and I have a little cataract starting. So on the Brain HQ, I notice on the ones that require me to see quickly or to hear, like ga versus ka, or little things like that, cognitive things. I notice that's where I do the worst, because these are physical problems. But does that indicate, it always intrigued me, does that indicate that I have a cognitive problem? Because it's just a function of the fact that I'm losing a little bit on my hearing, I'm losing a little bit on my sight, and that's why those are the questions, like in Brain HQ, for cognitive, which I don't know if people know what Brain HQ is, maybe you can tell them. But is this lack of cognitive ability, or is it actually just an aging thing where I'm losing a little bit of this sense or that sense, and with my fingers, I get some calluses in the winter, so I can't manipulate something, but then they go in this, you know what I mean? It's physical limitation, not really inside my brain, which I treat. Is that separate?
It is separate, actually. So there's, aging, because we've had so many years of studying aging, we actually know what is a typical aging trajectory. So we do know that there's expected sensory changes. Cognitively, there are changes as well. So, processing speed, memory, change with age. There's actually some things that get better with age. So your crystallized intelligence, so what you know about the world is going to get better. And surprisingly, your socio-emotional functioning gets better, your sense of well-being. So there are expected changes with age, and actually that's a really germane and very pertinent question, is how do we detect changes that are not the typical trajectory very early? And it's a fascinating topic, because in a digital age, your bank actually knows if you're missing bill payments before your doctor does, or your insurance company knows that you're not driving within your rate, or your radius has changed. And so with our digital signature, there's we protect our genetic information. We have lots of laws and regulatory bodies to do that. We have very little for your digital information, and that's telling you way more about your cognitive health than doing these cognitive tests or even seeing your doctor. So some of these things are more sensitive. But to speak to your point, there are expected changes with aging that don't necessarily mean that you're on sort of a worrisome trajectory. And there are, as researchers, we're trying to actually measure those changes as early as possible, and we're getting very creative in ways to measure them. That can then help us know who to intervene, who's the highest risk group. So it's actually it's a research question that you're asking, and also you're a model participant. So thank you for all of your hard work.
I'll take one more from the online. So as we talk about the brain-heart interconnection, how do you determine the link between the brain and heart?
Can I tell a little story? Just to save you. No. So so first of all, I'm not an MD. I'm a PhD. So everything I'm going to say has no value per se. But and I cannot give names. But we have a colleague in Ottawa who just giving a very clear example of the connection. Who was a very joyful father, joyful husband. Wonderful life, a very cool friend. We would go out and having drinks and having a lot of fun. And progressively, we saw his mood darken. And he became very depressed and severely depressed. And to a point where he was telling friends and us, I cannot continue. I want to end everything. And his wife, kids, friends could not understand what was going on. So that's probably the most severe stage of depression, where you have suicidal intentions. And at the time, there was no co-registration of brain and heart imaging or diagnosis. And then probably a year and a half in, a doctor said, we're going to look at your heart. And he had a blood clot in the coronary artery. He went to get a bypass. 24 hours later, he became the joyful guy again, like immediately, 24 hours. So this is just one example of the connection. It just took to remove a blood clot in the heart to completely erase his depressive disorders. I'm not saying this is a pure causal link. This is a beautiful, poetic example, I admit, but still, there is some magic to it. So I think this is one of the connections that people have discovered along the years. And maybe we can end with that, but I think time-wise, maybe we have another question? Okay.
Picking up on your comment earlier about having a colleague who's 108, based on your research or what you see in the literature and also what you see with your patients, what are your comments on the quality of life that older seniors have, 90 plus, in this case 100 plus? How's their quality of life?
I would actually love to hear your take, or even the audience take on that question. So quality of life is something I think that, when we talk about designing outcomes for studies, that's actually one of the things that patients really bring up, as one of the most important things. If you're asking for this individual in particular, this is a wonderful example of someone who is surrounded by an incredible social network. So this person is actually my academic great-great-grandmother. So my supervisor's supervisor is this person, actually. And they are surrounded, they actually live in the student ghetto. So they actually live in a student apartment building at 108. And when I go in, I'm in the elevator with a bunch of students. And so the quality of life, I think, that social fabric is so critical. And it's something I think that we sometimes lack in this, in sort of our age-divided society. So that trajectory is very individual, but there are certain things that provide some protection and some resilience, and I think that social piece is really critical. The interconnectedness between people. We know loneliness heralds dementia. That's one of, the quality of your social context is really key. So that's something actually, it's not just as physicians that we could do better, but I think socially that's actually one thing that I would love to see is really having people, having intergenerational opportunities for people, which I think don't exist to the way that they could in our society. But quality of life is, this is something I'd love to hear from the audience about too, because this is a key thing that comes up as an outcome that people care about.
If I could add a brief comment to it as well. Oftentimes, quality of life and quantity get juxtaposed as being in conflict with each other, and that can happen in individual circumstances when we're looking at life-prolonging measures and what have you. But when we're talking about disease prevention and health promotion, in general, the things that we do to improve brain and heart health will increase the number of years people live with a healthy life, with a higher quality life and thriving. So it's not just about extending the duration when you're treating your blood pressure, when you're managing stress or other things. It improves the number of years with quality life.
I was going to ask a question about neuroplasticity as we age, because I think that's interesting. Like we've all heard, you can't teach an old dog new tricks. And also to join the whole conference as well as this panel, we know that mental health affects the whole family just as much as cancer. And we all know that people need supports. And that family can be birthed or chosen. Some of us call them allies, because it's maybe not the family, but somebody that can support you. And then to tie it together with all the digital technology and everything, I think it was Jeffrey Hinton that said, AI will be better when it thinks like mums.
Okay, thank you very much, everyone. I want to give a special thank you to Well, Baptiste next to me, great job moderating, but mostly, yeah? Yep. Sure. Okay. Okay. Yeah. 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 Okay, you're in luck. We have a bit more time to ask some questions before we finish up for the night. Are there any other questions from the audience?
Hello. So this is a question for Heather particularly. So I was wondering, to form partnerships with indigenous communities as researchers or clinicians that are not directly related to these communities, what would be the best advice on how to approach it without being disrespectful or things like that?
Yeah, I think the first kind of point to make is that you need to take the time and to know that it's not going to be, I think this is a problem that happens in research. You show up, oh, I'm writing a grant. Can you sign a letter and be supportive in 3 months? Well, no, I don't know you. So it can take years to get to know people and to build relationships and to go to where people are at and meet people where they're at. Universities can be kind of intimidating and unwelcoming or unfamiliar environments, so you might need to go to the community, spend the time. I think the other kind of message that I would say is to come in that with that humble approach, that you're here to listen and to learn, and the communities are the experts, and so we need to go in and you know, we have 2 ears and one mouth, so we need to listen to what we're hearing and build those relationships. And there will be key people that will emerge that'll have that passion and those connections, and they can kind of help guide you through those relationships. But yeah, take the time.
I'd like to add to what you're saying. Time is very important. It's a very big factor for sure. It's like you have to enter that environment without a time limit. There is no time limit. It's when they're done, right? Explaining things to you, and to be a sponge. Just be a sponge. Just absorb everything from everyone, right? And then that's, as long as you're not confronting them and you're just receiving, that goes a long way. Yeah.
Well, are we okay? Do you want me to keep asking? I have a burning question, but okay. Okay, so some of the work that I do, whoops, okay, I don't need that anymore. It's fine. So some of the work that I do as a researcher is to try to understand patients' priorities for research questions. So there's many different ways that we go about doing this, but I'm just wondering, as we're finishing up, Iman and Vanessa, do you have any research questions that you think should be answered about the connections between the brain and the heart? Like, what is something that you think that researchers should go home and really start to investigate? No pressure.
That's heavy. That's heavy. Take the time, he says.
Take the time right now.
Will be a sponge.
Okay, yeah. Oh, I think it's important. I cannot say it enough that we need to go where they're at. You need to be where they're at, where that person's at, where that patient is at, and where that family is at, right? It's not just the patient, it's the family. It's their community, because we are now part of their community, right? It's not our community, it's their community. I think that's very important to remember in researching, is that it's not just you that's affected, it's everybody, right?
Jennifer, I don't want to put you on the spot, but why don't we organize a trip to those communities? You know, because we talk about them without going, but at some point we're going to have to meet with them where they are. So, sorry. Get a budget.
Thank you so much to our co-moderators and to our fabulous panel. I'd like to start by just giving all of them a round of applause for your amazing engagement. And I'd like to also acknowledge and to thank all of you in the room here with us tonight, and to the folks online. You've had wonderful questions for the panel tonight, and we're really excited to have you engaged in this work of the Brain-Heart Interconnectome. So a round of applause for all of our participants too. So we really do hope that you've all found the event both informative and engaging tonight. At the BHI, we really do strive to bring scientific evidence into policy, into practice, and into community. Tonight, we've talked about the different opportunities that patients and their families have to engage in research. We talked a little bit about how folks can engage as study participants. But I think it was Maya who mentioned the term in terms of we try to approach research in a way that where we co-produce research with our patients and our community members. So I just wanted to bring that back up as another opportunity to be engaged in research. It's not just as a participant in the research studies, but it's to engage in the designing of research questions and methods and events like this. So if you're interested in being engaged, please keep in touch with the BHI. Yes, we'll direct you to our website as a first point of contact, but there's real people behind that website, and we're really happy to engage and to have conversations and to see where there are opportunities for best fit with you in the work of the BHI. So please don't hesitate to keep in touch with us. We have a newsletter where you can sign up and hear about upcoming events. We try to have these events in the community on a fairly regular basis. We do so with many of our partners in the BHI. We're planning to have one later this fall here in Ottawa, again in collaboration with Brain Canada, who have launched an amazing series of events called The Amazing Brains. And so just keep an eye out for that, because there's lots more to come. So now this evening we have the honor of inviting one of our dear friends, Elder Vince Kiknosway, to close out this evening's event and to close out the Brain-Heart, the BHI State of the Science Summit for us as well. So Elder Vince is a member of the Walpole Island Loon Clan. He is a father of 4, grandfather of 11, and great-grandfather of 3. Elder Vince has received numerous certificates for his volunteerism with many Aboriginal organizations, with the City of Ottawa and other agencies. He's also received several meritorious service awards, including the Ministry of the Solicitor General and Correctional Services, and he had a 20-year service award from the Ministry of Community and Social Services. So Vince is proud to follow traditional ways and to continue to learn on his healing journey. And we thank Vince for his ongoing engagement in the BHI, and we would like to welcome and thank Vince for closing out this evening's event.
Thank you very much for your patience. I thought I had plenty of time leaving 6 o'clock, but traffic downtown is something else. So I want to once again thank BHI and Summits, the Science Summit, and for the invitation to not only open a very important part of life. As I had indicated in my opening, and some of the grandmothers and grandfathers have shared with me how important it is in relations to our brain. And that there will be people that will cross our paths so that we may provide our voice, so that others hopefully will allow themselves to open themselves up to recognize the elements in today's society, today's world, that are causing a numerous amount of different unfortunates in life. And we are here as individuals hoping that we will continue the best as we can in dialoguing more with others within the world, in hopes that these things that are happening in the world, that we could hopefully make some choice and changes and whatnot. But I guess it comes from within ourselves, and that's the important part. That's how the grandmothers have shared with me. As long as I have inner faith within myself, that my mind will go to my heart to recognize the importance of who I am and what I'm willing and trying to do. And this is where you are. You are that important element in life, in recognizing in that. So with that in mind, I opened with the white goose wing, and this is our highest, and being bestowed is the eagle feather. And I will ask the Creator to join us in mind, body, and spirit, and that we will be able to recognize the importance of what BHI has continued to do and provide the insight for the world. So with that in mind, Kijamada do, Kiwanzins indigenous mon do dem. Kiwanzins indicate miigwech no, migasa. Kijamada do, BHI. Samana indicate miigwech Kiwanzins no. Miigwech no wingas no. Kijamada do, Kichimanatu. Our Great Spirit, our loved ones who have entered that spirit world. I've asked silently in our opening to guide, to provide that insight of guidance for a well-worthy cause of BHI and its work towards what life means humanly. We all, and I, had indicated, not only once but twice on the day of the opening, to recognize each and every one as I took a photograph with my eyes, a camera shot, that we will continue within our mind and our hearts to fulfill what we feel individually in regards to what BHI is meant for. So in closing, I give thanks, Kijamanadu. I give thanks, Ishpiming, for all of the elements in our Father's territory, the clouds, the winds, the air that is necessary for all living kind. I give thanks to Shkokamekwa, Mother Earth, who we walk upon. I acknowledge and give thanks to Anishinaabe, Mo, and Algonquin people that I've been privileged to walk upon in this region for the past 51 years. And I acknowledge Kukum de Begeezus, who came full circle nights past. That's our grandmother, we call the moon. And we ask, and I ask, for continuance in relations to each and every one of you here, to all your families, as I had indicated in my opening. You are that part of life that provide that insight for the growth and continuance in the science of the mind. So your children are those who will follow those footsteps, just as I have chosen from those grandmothers and those aunties. I give thanks to them. I don't want to exclude the uncles and the grandfathers, but it was mostly the women who nudged me to do and continue to do what what they must have seen something worthy in me. So I continued to do that. So I say, in regards to, as I had indicated earlier, an acknowledgement to the women that have crossed my path and created these traditional medicines in the spray. So to the Wabanang Miigwech, Shawanang Miigwech, Ipeng Mishmuk Minang Miigwech, Kiwidignang. To all those 4 directions that either or of any of yous that have relatives in any part of the world, I offer that. I offer that in acknowledgement. That's the way the grandmothers have shared with me how important it is for me to offer the prayers. And I say to those, a safe journey to your loved ones or to wherever you are going. I say, Wabanang Miigwech, Jawanamanichnak Jamanadu. To those from the south, Jawanang Miigwech, Jawanamanichnak Jamanadu. I say to all those and their relatives from the west, Ipeng Mishmuk, Miigwech, Jawanamanichnak Jamanadu. And I say to all those from the north, Jiwidinam, Jawanamanichnak Jamanadu. I have completed that full circle in my mind, so I give thanks to each and every one of you and all the very best to you in the upcoming and results of what you have worked for in the past 2 days. Miigwech, thank you very kindly.